Hospitals say they are still having room for new patients. Intensive care beds in Arizona are nearing capacity, but they haven't reached their limit yet. According to the state health department, who keeps track of hospital capacities around the state, Arizona ICUs are running at 90% capacity, and hospitals we spoke to say that they still have ICU beds available if they're needed. They're using the ability to move patients around the state and sometimes out of state even to keep some beds free. And ASU researchers tell us that hospital staffs are working overtime trying to keep up with the virus.
These COVID cases stay longer in the hospital than typical, other illnesses do. Most other illnesses are managed relatively quickly. People are in for 2 or 3 days and they're out again. COVID cases can last a week or 2 weeks in the hospital, and so they're still seeing a greater number of patients getting admitted to the hospital than they are seeing getting discharged.
477 people were discharged from the hospital yesterday, one of the largest single-day discharge rates since this pandemic began back in March.